Hello everybody, I am Dr. Vikas Mittal. I am Director, Pulmonologist, CK Birla Hospital, Punjabi Bagh and Wellness Home Clinic and Sleep Center at Paschim Via. See, differentiated TB care was a concept which was published recently uh, after a study done at multi-center in basically from Chennai, and it was published in 2021 and has been started as a pilot project and been started and it's been now getting implemented in our TB elimination program as a pilot project. Okay, from Indian Council of Medical Research, from Indian Council of Medical Research. So, differentiated tuberculosis care is a concept in which we take care of tuberculosis patients. We triage the tuberculosis patients who are at high risk for mortality. Means we check the patients who may have a death threat from tuberculosis, like those who are malnourished, underweight, who are not able to sit without support, who have a high respiratory rate, or whose oxygens are low, or who present late with tuberculosis and with complications, and who have comorbidities like diabetes and other diseases along with tuberculosis. So these are some patients which have a high risk for dying from tuberculosis. So there was a concept which was published that if we give them these patients, we triage these patients of tuberculosis from the whole lot and then give these patients a specialized care, a differentiated care, then this will decrease the death of these patients and it will decrease in the like losses and overall loss of life as well as the cost, and overall healthcare will improve. And it is being currently employed in drug sensitive cases, and slowly and steadily it will be employed for drug resistant cases. So the factors I've already told you are the ones which increases the death rate in tuberculosis. Okay, so these are first is like the patient base, like the patient is undernourished. Okay, his BMI is less than 14. Means the patient is so thin that he's not able to hold himself or sit or stand on his own, and he's in a respiratory failure if his breathing is more than 24 per minute, or if his oxygen levels are going down below 92, or if he is having any comorbidities like diabetes, uncontrolled diabetes, blood pressure, heart failure. Okay, so these are some factors which will help us basically know these are the decisions which will help us give these patients a differentiated care. So these are the patients which will have a higher risk of dying from tuberculosis or having poor outcomes of tuberculosis. They will need to be admitted in the hospital, taken special care by giving good nutrition, giving extra proteins and calories in their diet, and a good supplementation and care of their comorbidities by controlling their diabetes, giving oxygen, admitting them, getting them tested. Okay, so these are the patients which needs to be differentiatedly cared for. And actually the influence what has influenced the decision is some landmark papers from Tamil Nadu, which has actually shown that if we really give these care, it really improves the outcomes of tuberculosis. So these are the papers which have really led to the policy makers also to consider this, to incorporate this as a pilot project through ICMR in our tuberculosis elimination program. See, this differentiated TB care is actually being studied in the resource limited setting only. Okay, see, the resource limited setting is like for a country like India, where the resources are limited, but actually these resources are, if properly utilized, by giving this differentiated care to this high mortality or patients with high mortality, it will actually prove to be of benefit rather than it will prove to be of helping in decreasing the use of resources rather than increasing the need for resources, because you are providing a holistic and a broader approach to the patient and in decreasing their mortality. So if we really do an analysis, it is actually not going to cause a problem. So it is actually fit for places which are resource limited. The most important message for TB patient is to not neglect any long cough or any long problems of lungs, vis-a-vis like long fever going on and cough going on for months, and seek early care whenever they get these symptoms. And if you feel that there is some lacking in your care, then I would say rather than landing up into a trouble, just consult a like a program where like a government program where there is a specialized care available. Okay, and if your GP or a general physician or your doctor is suspecting tuberculosis and you are feeling you are not improving, so you can just get and you can try and get to a center where there is specialized care available. And the second is, do not break your medicines, and be in touch with your doctor. Whatever is being advised, just follow it. And if you are still not improving, just discuss again with the doctor. There could be many factors which may be leading to non-improvement. So all these factors will be taken care by the treating doctor. So you have to go back to your doctor even if you are not improving.